Thank you so much for having me. And thanks to everyone for joining. It's really a privilege to be here, and hopefully I can share some things that are useful to you. I do want to just reiterate what Mira said. Really happy to have questions, and they can be questions about the content or questions about your own sleep or things like that. I'm very happy to answer these, and I think this session is hopefully for you. And then secondarily, to a much less degree, but I still hope it can happen, I would love to hear from you and learn from you, because I will say, well, there's a lot of research on sleep after cancer diagnosis. There is only a tiny amount of research specific in pancreatic or upper GI cancer. And so there's a lot that may be unique in your experiences that we simply don't know and that I don't know. And hearing from you and hearing where there may be challenges and things like that, and what may work well, can help give ideas for perhaps where to go and where more work is needed. And ultimately, hopefully, continuing to improve the sleep and the well-being of people after upper GI cancers. So with that, I want to start off talking just a little bit about some basics about sleep, sort of what it is and what some of the building blocks are. And perhaps we'll start off with what are some of the different kinds of sleep problems. And not all sleep problems are the same. This is a rough idea, but we often think about a few different types of problems, a few categories. One of those categories are sort of temporary or transient, what we might call sleep disturbance, right? So that's when something interrupts your sleep. That might be, for example, you wake up with pain. That might be you need to use the bathroom, right? That could be a noise, a sudden, your dog barks or cat howls or whatever. Do cats howl? Anyway, some sort of noise interruption, right? Something that interrupts you. And you might have regular interruptions, but we think about those as kind of a disturbance. So kind of something from the outside coming in, right, that kind of breaks up your sleep. We'll also think about, and I'm sure that you've all heard about this before, I think it's quite in everyday kind of everyday attention, is the idea of insomnia. And when we think about that from a sleep perspective, it's a little bit more. Insomnia isn't just not sleeping well one night. It's some more regular, ongoing struggles to either fall asleep or to stay asleep. And I'm sure that many of you may have experienced this at one time or another, or maybe right now. Quite common. Many people do experience insomnia at some point in their life. And we know that after cancer, there's more likely that people will experience this. And the difference really between the sort of insomnia and the sleep disturbance is really in the duration, so that it's more ongoing, and that it's less just about sort of, I fall asleep and something wakes me up, and often more about either difficulty falling asleep or staying asleep. So you'll have sometimes good sleepers, a dog barks, they wake up, but then they're able to fall back asleep. And when people have insomnia, when that dog barks, they wake up, they're kind of stuck awake for, 15, 20, 30, 45 minutes. So that disruption becomes much less temporary and becomes sort of much longer. And then, while I'm not going to talk about this a whole lot, it is important to recognize that these exist. There are other sort of sleep disorders, things like sleep apnea, sort of often associated with things like snoring. So that's where you stop breathing throughout the night, actually. There's things like restless leg movement, where you have sort of uncontrollable movements in the limbs, particularly the feet, but it doesn't have to be the feet, and that disrupts sleep. These sort of what I might call more medical sort of sleep disorders, I'm not going to focus on today, because if you have them or if you're concerned about them, we really need to get you into a sleep clinic to assess them. It's not something that you can sort of do a whole lot just behaviorally around. And even to determine whether you have it or not, it's easiest to do with sleep specialists and in a sleep clinic, where we can actually take the right measures to say, yes, you are stopping breathing throughout the night, or no, you're not. But these are a few different kinds of the sleep problems. And it's kind of helpful to think about these, because if you're not sleeping that well, figuring out sort of, well, which of these sort of categories am I maybe struggling in can help figure out, well, what changes might be done or where might you go to seek help and to improve that. I want to talk just a little bit about why sleep is commonly a problem after cancer. I don't think any of this is going to be that surprising to all of you, but it perhaps just helps in thinking a little bit about what some of the challenges may be, and then how we might sort of counter some of those. So we know that there are some biological factors. Tumors are those that the cancer cells, their growth, and some of the chemicals that they send off, the inflammation that can come, and the changes in the body around that there's evidence that that can directly be related to sleep. So some of that, right, that's kind of just the nature of the cancer itself can cause some sleep problems. Of course, there are psychological and kind of our mind plays a role. Cancer, its diagnosis and treatment is very commonly quite stressful. There may be feelings of depression or sadness or loss, and there may be worries or anxieties. What's going to happen? What will happen next? Will I get better? Will the treatment be like? And our mind plays a big role in how we sleep. If you have a very active, busy mind, if you're very anxious or worried about something, it's a lot harder to fall asleep in that moment. That's very natural. There's nothing wrong with it. It's not that you shouldn't. It's not that it's sort of bad to experience that. I'm not saying it's that you want to experience anxiety, but I'll say it's very common to experience that. But it's also disruptive to our sleep. So that's another thing that happens. There's very often behavioral changes around cancer and its diagnosis and its treatment that can make it harder to sleep. And so you might be tired and out of energy and more likely to nap. And I'll talk about why that can be tricky for sleep. Hospitals are typically terrible places for sleep. They have their own routines that aren't your routines. They're disruptive, they're noisy, they're bright. And so there's lots of things there that kind of throw off your sleep. And it can set you sort of out of whack and then make it harder to, you kind of, even once you come home, you might need to kind of reset and try to get back onto your own routine. And then just our routines are really important for how we sleep. Off work, I mentioned here, if you were working, and even if you're retired, everyone has their kind of normal at-home routine, and that often changes around cancer. And when our routines change, that can influence our sleep. And I'll talk more about sort of why and what we may be able to do about that. And then, of course, big ones, cancer treatment and all of the side effects from cancer treatment that I'm sure you all could tell me about much better than I could tell you. But many of those side effects are not that helpful. And some of the treatments directly themselves can be impactful. So we know that chemotherapy can influence sleep. We know that, say, if you've ever had dexamethasone, dexamethasone tends to make you alert and have trouble sleeping. So again, there's lots of things that happen that are really not anything that you're necessarily doing, but just part of the process of cancer and its treatment, unfortunately, that have a big impact on sleep. Just a few general statistics. This isn't unique to pancreatic cancer. As I mentioned, I struggle to get that level of information. But when we look at this, the prevalence of some insomnia symptoms after cancer is around 60% of people will experience some. So it's really, really common. Something else that tends to go with poor sleep, but in the context of after cancer is a little bit distinct from it. It can be related, can be distinct, is fatigue. And we think about, it can be easy, I think, to think about sleepiness and fatigue together. I like to encourage you to try to distinguish sleepiness from fatigue. And it can be a little bit useful to be able to do that. So we think about fatigue, at least from a kind of research perspective, we'll be talking about kind of a lack of energy, that tiredness or a state of weariness. That's also super common after cancer. About 3 out of 4 people experience it at some point. This is a little bit different from sleepiness, which is that sort of, I would be falling asleep. Now, if you're really sleepy, you're probably also tired, but you can be tired or out of energy without that sort of sleepiness, I want to just nod off. And they can be a little bit helpful to distinguish, because sometimes it may be that we feel quite fatigued and we think, oh, I'm not sleeping well, but it may not be sleep. It may be something else. It is cancer-related fatigue that isn't related to sleep. And of course, at the same time, if you don't sleep very well, you're very likely to feel fatigued. But where that's helpful to distinguish is I think there are some people that have sort of fatigue, but not necessarily sleep problems. So if you're kind of getting decent sleep at night, but you're still really tired during the day, to sort of see if you can tell, is this tiredness a lack of energy, or does it feel like if I could just lay my head down, I would fall asleep? If you sort of think, if I could get comfortable, I would be asleep in a couple minutes, that's more likely to be sort of sleepiness than just fatigue. If you sort of think, I'm so tired, I don't have energy, I'm just sort of sitting here. But if you think, but if I were to lie down, I wouldn't fall asleep straight away. That might be a little bit more fatigue than just sleepiness. It can be hard to tease them apart, but it can be a little bit helpful for trying to understand where might this be coming from, and what might help it. Then another big thing that happens and that we know gets disrupted by cancer, its treatment and hospitalizations and all of that business, is our body clocks. And the technical term for this is circadian rhythm, but I'll use body clock mostly in this presentation. And our body clocks is this sort of 24-hour rhythm we have. I'll show you a little bit more on this, but most people will have kind of a cycle where they sleep and then they're awake, and then we repeat that, right? And then we sleep and then we're awake. And you kind of go through this cycle about once per day for most people. And our body clock is really important not only to our sleep, but also to our daytime energy and fatigue. And so if that's not operating that well, then that can make us have trouble sleeping, or it can make us more tired or fatigued in the day. A few of the building blocks that I tend to think about for healthy or good sleep. We want a really well-functioning body clock, and I'll talk more about that. We want good sleep drive, and I'm going to go into detail on that next. We want to associate bed and sleep. So you want to sort of, when you think about your bed, you want to think about and sort of have it paired up with your body with sleep. It's often more important to get good quality than good quantity. It's not always easy to get good quality, but that's often more of our focus. We want to have sort of good thoughts around sleep, and a quiet mind, a relaxed body are important to sleep. If we're really active, if we have a very sort of busy mind, that's often not easy to have good sleep with. Now, a few of these are probably common ideas, but one of them may be less so, and that's sleep drive. And I want to talk about that because it's quite important. And once you know about it, it kind of empowers you to understand what's going on and what changes you might make if you want to. So sleep drive is the way we kind of talk about it technically. I like to talk about it as sleep hunger because I think it makes it really kind of clear what it is. If you, if you're not nauseated, right? If you miss a meal, you might get sort of hungrier. If you haven't had lunch and it's 2 or 3 p.m., you're more likely to be hungry, right? So that the longer you go without eating, kind of the hungrier you generally get. And sleep is kind of the same way. When you wake up first thing in the morning, you don't have a very high sleep drive. The longer you stay awake, that sleep drive or that hunger, that desire for sleep starts building up and up and up. And eventually, it should be quite high around the time you fall asleep, and then it will come down as you sleep. It goes away, just like when you eat a big meal, your hunger goes down. Now, where this is helpful is that basically staying awake longer is going to make you sleepier and fall asleep quicker. So say if you're having trouble, the difficulty falling asleep, and if you use myself in this example, woke up this morning, if I tried to go to bed at 1 p.m., I'll have a very small sleep drive, a very small sleep hunger. I won't be very tired, and I'm going to go to bed and I'll lie there and probably not fall asleep very easily. If I stayed awake for 24 hours, I'm going to have a very high sleep hunger. I'm going to really want that sleep. And when I do lie down, I'm probably going to nod off to sleep quite quickly. And of course, that's not the only thing. There's multiple factors that influence our sleep, but this is one of them. I like to think about naps a little bit like snacks. If I'm getting ready to go to sleep at 10 p.m. and I took a nap at 8 p.m., it's going to be harder for me to go to sleep at 10 p.m. In the same way that if I had a meal coming up at dinner at 6, let's say, and I had a big snack at 4 p.m., I won't be as hungry for that dinner at 6 p.m. So this is one of the core things that we know drives sleep. It increases with being awake. It decreases quickly when we sleep or when we nap. And we kind of often feel it as sleepiness. If you notice that you're having difficulty sleeping throughout the night, or you're having difficulty falling asleep, skipping naps, as an example, can be helpful. Now, I know that can be tricky because sometimes you have a bad night's sleep and you're really tired in the day and you want to need that nap. So I'm not saying don't nap or never nap, but to be aware, right, that if you do nap, that'll reduce your sleep drive, and that might make it a little bit harder to fall asleep after the nap because your sleep drive has already come down. Something else that can be helpful is getting up around the same time. Where it's possible, and I think you always want to listen to your body, but where it's possible, even if you have a bit of a poor sleep at night, waking up at the same time you usually do in the morning can help with this. Because if you do that, you'll have a high sleep drive by the time you fall asleep the next night. Whereas if, let's say, you have a bit of a bad night, and so you sleep in till 11 a.m. or something. Now, if you only woke up at 11 a.m., you won't have had as much time to build that hunger for sleep by your normal bedtime. And so it'll be the following night can be harder to go to sleep. And this can create sometimes this kind of cycle where we have a bad night, we try to compensate for that bad night, that makes the next night kind of harder, and you end up in this kind of little bit of cycle of poor sleep over multiple nights. Right. The last new concept I want to introduce, and then this is the it for education, and we'll talk more about what you can actually do, is our body clock or our circadian rhythm. So it's this 24-hour cycle, right? We're alert and awake, hopefully, during the daytime. We get sleepy in the nighttime, and then we're back to sort of alert and awake the next daytime. For most people, this is about 24 hours. And this is another factor that plays a really important role in when we sleep and when we wake up, beyond that sleep hunger that I talked about. Our body clock sends alerting signals in the morning that helps us wake up. Why we wake up? It helps us stay awake, to focus, to be attentive, to have energy. And conversely, it helps us fall asleep or sort of sends low alerting signals, basically telling your body it's time to sleep now in the evening, typically. We'll all have a little bit different body clocks. So you may have heard things like a morning lark or an evening owl. People sometimes talk about themselves that way. People that prefer to be up at night or prefer to be up in the morning. I'm sure that you all know different people that, have preferences for sort of when they're awake. So the timing of that 24-hour rhythm isn't the same for everyone. Even if it's roughly 24 hours, one person may like to wake up at 9 a.m. Someone else might like to wake up at 6 a.m., things like that. One of the most important factors that controls that body clock is light, the light we get in our eyes. And oftentimes, bright light in the morning and dim light in the evening helps tell that body clock when it should be synchronized to. Body clock problems are treatable. And so if you have these, there are ways that we can work with it. All right. Any questions there? Any concepts that people want more explanation about? Experiences that you may have had that you'd like to share?
Oh, hi, Jan Stuckey here. Thanks so much for that. I think most of us who've been going through treatment notice a change to our routine for starters. I think what I found probably one of the hardest, apart from the dexamethasone stimulating you, was the chemo fog, as well. Your brain's not as clear. So you do find you need to nap during the day. You find you need to rest a lot more. And so then you get to that almost desperate stage for the good night's sleep. So I guess really I'm interested in your thoughts about sleeping pills and things like that, even, through the worst time of it, because a lot of our doctors and oncologists, I'm sure, really want our comfort, and for us to be able to feel that we actually are able to control something, because your control is totally taken away from you in these situations. So I guess that's really, for those of us who go through treatment, and I went through 10 months of it, and I'm sure people online have as well, and it does seem never ending. I'm out of that now, and I'm still having awful sleep problems, but they're a bit different. So if you wouldn't mind talking a bit about the chemo effects as well.
Yeah, for sure. So look, I think that's an extremely common experience that happens. Where there is a lot of disruption. There's the stuff like the dexamethasone that can throw you off at night. There's that lack of energy and that tiredness and the fog, as you were talking about, during the day, that a lot of people report. And so I think, napping can be useful tool in that situation to help with the daytime tiredness, the daytime sleepiness. The couple of things that I would recommend, and again, I think a lot of this you have to personalize. So it's hard to give, one recommendation, because, and even for a single person, it's going to be different on different days. But where you can, move the naps earlier in the day. So if you think about this sleep drive, if you're hoping to fall asleep at night over here, can you all see my cursor where I'm kind of trying to circle, by the way? Okay. If you're hoping to fall asleep here, try to get your nap as far away from that as possible. So more in the morning time, the late morning or the early afternoon. Napping, say, if you wanted to go to bed, if you normally go to sleep at, say, 10 p.m., 9 p.m. would be kind of the worst time to take a nap, right? Or 8 p.m. or something like that. So move it earlier where you can. I realize that's not always controllable, right? Because you may be okay in the morning and, it's in the afternoon, you just have this miserable tiredness and you're like, I can't take it anymore. It's 5 p.m. and I know it's a little bit late, ideally, for a nap, but, it is what it is. So I think that will happen sometimes. But where you can, sort of nap a little bit earlier, that can help. If you do nap, if you can control the time somewhat, so as in, okay, I'm so tired, I've got a nap during the day. Maybe can I make it a half-hour nap or something like that, rather than, say, a 2-hour nap? So you try to keep it short enough, long enough, I guess, that it sort of helps relieve that desperate tiredness and sleepiness that you may be feeling, but sort of as short as you can sort of tolerate. And you're doing is trying to save up your sleep for the nighttime. Sleeping pills you mentioned. So there are medicines that can help you kind of acutely fall asleep and stay asleep while they're in your system. I think that those are really commonly used after cancer, and they have a place and they can be helpful. They're not intended for long-term use. So they're not things that you want to sort of ideally be on for months and months. Most of them are sort of approved for around 6 weeks daily use. Now, with that said, I will say that we've had plenty of people come into our sleep clinic who've been on them for years and years, but they're not really intended or optimal in that sort of situation. Where I think they can work really well is sort of use as needed, so that you might not necessarily be taking them every night, but you sort of take them on those really bad nights. You take them when you've got lots of symptoms. You take them when you're taking dexamethasone and you're going to be alerted and sort of woken up by that to help. So those are things that can be some of the things that can be done. The other thing I think that isn't, it's not the answer I wish I could give you, but I think it's perhaps the best way forward, at least for now, is doing chemo to have some recognition and some acceptance that your sleep isn't going to be that great. The best you can get it doesn't mean that there's nothing you can do about it, but sort of the best you can get it isn't going to be perfect. Isn't going to be like it would be outside of that, probably. And sleep is a tricky thing, because one of the things about it is sort of, it's not something that you can force. You can't sit there and say, I want sleep so much, and I'm just going to try really, really hard and force myself to sleep. It kind of doesn't work that way. And so sometimes some sort of letting go, if you will, and sort of some degree of acceptance that, well, tonight isn't going to be a great night, is probably going to be a little better for you than if you will, trying too hard or getting really frustrated, that I'm tired and I can't sleep, I had another bad night, that sort of thing, where you almost kind of get in a fight with yourself, right? And it doesn't help you and it doesn't help the sleep. So I think those would be some things that, I would suggest or consider around chemotherapy and sleep. Do what you can, improve it where you can, nap a little bit shorter if possible, nap a little bit earlier in the day where you're able. And then if you do have a really long nap, at 5 p.m., you're desperately sleepy, you have a 2-hour nap, you wake up at 7 p.m., I probably wouldn't try to go to sleep at the normal time you do go to sleep. Just recognize you probably won't be quite as sleepy at your usual bedtime, and you might need to stay up a little bit because you did just have this longer nap. And that is what it will be, I don't know if that helps, if that answers your question some, Jen.
And
sort
just
of, yeah, sort of. I mean, I've been doing all that. I'm fortunate. I'm married to a GP, and I am fortunate for all that. I think the other thing, though, Joshua, when you're saying a lot of people don't understand about our pancreatic and GI cancers, we need 6 meals a day. So, we have to space those. A lot of us will have what you call a dump. So for me, I go pale, my blood pressure drops, I go nauseous, I get giddy, I go to the toilet and dump, and I need to lie down after that. So tough what time that is. So it's extremely difficult to get a routine going. And even though now that I've finished all my treatment 4 months ago now, I'll have a really great week. The sleep's awful, but my body, I feel I'm actually getting some control over the functions again. And then you'll be thrown because you'll have this dump, you'll have had a week of good, and then you'll get a dump like middle of the day or early afternoon or whenever. So I think it's just so important to be able to, again, I know you can't control, but it's nice to be able to take some control back of some things, because you get scared to go out, you get scared to go on holidays, you really do get quite fearful. And I'm mindful that I'm taking up everyone's time, so I don't want to keep talking because there's others on here as well. But I think it's understanding that our cancers are different, and you've acknowledged we're all different. So it's trying to fit. I mean, you can't force sleep, as you say, but you also can't force some of the changes because we've had so many of our organs removed or affected. So I just ask for that to be put into consideration.
Yeah, look, those are great points. And thank you for taking the time to share that. I think definitely don't feel badly about taking up time. And it's helpful for me to learn as well. On the dumps you mentioned, those times when you have to lie down, I think that was something else that you mentioned. I think it is a good point. So I will say sometimes you might be tired or just have no energy, need to lie down. And if you can too, it's okay to rest. I would say probably kind of whenever you want. And there's a difference between rest and sleep. So if you're tired or you feel really crummy and you want to go and have a lie down, if you can lie down and not sleep, say in the day, that's perfectly okay. Lie down, not sleep will have much less impact on your sleep at night than lie down and sleep. And of course, you may fall asleep, right? And so these sorts of things happen. And again, I think it's not always, as you say, it's not always controllable. And I wouldn't even sort of say that you want to not nap and sort of only sleep at night, because if you've had a really bad night's sleep, catching up with some naps can be helpful for that. And the timing of things doesn't always play out the way that we wish. But I will, just to sort of add, I think that the daytime resting is different from napping. And so sometimes if you are sort of tired, think, could I have a bit of a lie down or a quiet sit or a comfortable sit? And would that be a way that might help me feel better, help my energy a little bit, and perhaps have a little bit less impact on sleep that night? Question in the chat. I'm napping during the day, yet at night struggling to get a good night's sleep. Is my napping causing me to sleep less? So it's a little bit hard to say, and I couldn't say for certain in your situation without lots of information. But in general, what we do know is that, yes, more nap in the day, less sleep at night. So there tends to be a relationship there. again, I think there's lots of caveats, and I don't want to come across at all as discouraging naps or sort of saying don't do this, because I think it's a helpful tool, and especially when our routines aren't off and we can't control all the aspects of our routines, getting sleep where you can is going to be better than not sleeping at all. But you can sometimes do something you might be able to try a little bit is some experiments. So, if you can think, well, let's say you have a routine where you nap every day, try 1 or 2 days where you don't. See how you sleep that night. Is it a little bit easier to fall asleep or a little bit easier to stay asleep? Does that night feel better? And then the following day, do you feel better? If you do, maybe keep that up. If that seems to be making it worse and you sort of say, actually, I skipped a 2-hour nap and I only got like half an hour more sleep at night, then that might not be the right answer for you. But in general, more napping, less during the day, less sleeping at night because of that sort of reduced hunger or drive for sleep. Really good questions. Any others? Okay, well, I might keep going a little bit. Always feel free to jump in with points or questions. Really valuable for me and really great to hear some of the unique experiences as well. Because like I said, I'm not, there isn't as much sleep work done in pancreatic or upper GI cancer. And there are things that can be unique. And so I think there are places where we need to say, okay, well, what is going on and what can be done differently? So advice I'm giving is very much around sort of my knowledge and my work with cancer, but less so with yours specifically. And it's a place that I need to learn and I want to learn. So I really appreciate whenever you sort of experiences that you share. So broadly, some of the things that we think about when I work with people around improving their sleep, these are just some key principles. Generally speaking, cognitive and behavioral approaches are preferable over medicine. Now, medicine has a really important place, and I think we had that discussion, and it's going to be for shorter term things and for specific nights, it can be really helpful. But there's been lots and lots of studies done, and in general, it's not recommended as sort of the front line. Partly it's because a lot of medicines that we currently have, unfortunately, they're not perfect. They don't just help you sleep. They come with some side effects. They come with some interactions that can go on. And especially if we have to rely on them long term, they start sort of coming with more and more side effects. They can become less effective and they can build up some dependence where when we stop them, our sleep gets sort of even worse. So that is nothing to say that they are not helpful and that they don't have a critical place, but to say that they're not sort of the only thing and they're often not our first choice. It can be really helpful to try to identify all the contributing factors. Now, that might be quite a big list in some contexts, but really trying to understand and think through what are all the reasons. Some of these might be things that you're doing. Some of them might be things that you don't have a lot of control over. A lot of times, sleep is something that happens, that gets disrupted when our bodies are disrupted. And of course, after cancer, our bodies are very disrupted. One of the implications of this is that working on sleep might not just involve, or in trying to improve your sleep, might not just involve working on your sleep directly, but might involve doing what you can and working with other experts and people around helping the rest of you be as well as you can be. So if you've got a lot of pain, for example, and pain is what's keeping you awake, then trying to work on, well, other ways to manage that pain. Can you get that under control to some degree? Because if you do, then that might be the thing that's impacting your sleep. And it might not be that you need to change much at all about your sleep. And it's that you've sort of got quite a bit of pain. And that might be the priority to focus on. Most of the time, I bold here all. And I do that just in recognition that in almost no case of people that have trouble with their sleep is it just one thing. It's just like, oh, well, I just have pain or I just have this. There's very often lots of stuff that's going on that influences our sleep. So it's normally not simple, but if you can find all of those and figure out either what are the big ones and try to work on those, or if some of them are just uncontrollable, right? There's these things that are sort of, it sucks, it's awful, we've done what we can about it, we can't sort of fix it, then you might look and say, well, what are some of the other things that influence my sleep that I can work on? Where are some areas that I can exercise control if there's control taken away from me in some regards? Making a plan around these, and that can be part of this thing around figuring out, well, what aspects can I actually control, or am I comfortable, or would I like to change? Sometimes there's things that we might say, well, this might be better, but I just really don't want to do that, or I can't do that. It might involve, and I always really encourage people to involve partners or other people in the household to degrees as that as well, because sometimes many people live with other people, and those people can help you sleep or they can hinder your sleep, right? And so working with them, involving them in that, if you're going to have a nap and you want it to be a good nap, can you make sure that the house is quiet at that time, or that you've got a quiet, calm space to do that? If you're going to sleep earlier or later or whatever, can you make sure that you've got that space and that other people are sort of on board with that? It doesn't help if you are just getting into the phase you're like, now I'm going to have a great sleep from 5 to 8 a.m. and someone gets up and starts mowing the lawn or something, right? As much as possible, address all the factors. Address all the factors that you can or are able to. Again, just to, I guess the main takeaway here is normally we have to work on more than one thing. It's normally not sort of, there's not a silver bullet. You fix this one thing and wow, that was it. Now I went from terrible sleep to great sleep. That pretty much in no one do we ever see that sort of happening. It's almost always multiple things. And to be patient or to be persistent. So sleep changes normally take weeks. So it's not something that sort of, if you start making changes, I wouldn't expect of any sort of big improvement that day or that night. It tends to take some time. One of the first things that we think about, some of the basics, and I will bet that a lot of you already know all of these, but I will go through some of them anyway. They're sort of foundations of what we often call sleep hygiene. I don't really love this term hygiene because it sort of sounds like if you don't do this, you're unhygienic, which is a ridiculous idea. But there are factors or behaviors or things that we do that can influence sleep. So limiting caffeine or stimulants, mostly it's caffeine. And of course, if you're on something like dexamethasone, don't limit that. If you're told to take it and you need to take that for other things, I'm not telling you don't take it, something that you're prescribed or recommended. But if you can limit caffeine intake, and if you do like a coffee in the morning, that's not a big problem generally. But especially in the later day, what I often tell people is sort of 6 hours before bed, really try to reduce it. If you're okay with it, even considering sort of 8 to 12 hours before bed, sort of stopping caffeine, because the duration that if you have caffeine, that some of it will stay in your system for 12 hours after you have it. So not a big deal, I would say, to wake up, have a coffee, a tea, whatever in the morning. If you can sort of, stop around noon, that's often helpful. If you do have to have it a little bit later, or you like to have it a little bit later, sort of stopping it as early as you can, basically. Limiting nicotine or smoking. Again, it's another chemical compound that we know kind of wakes us up, alerts us, makes it harder to fall asleep. And similar advice would go here if you were to smoke, if possible, to smoke earlier. So sort of further away from when you wanted to sleep. Alcohol is an interesting one. I don't know how many people with pancreatic cancer or upper GI cancer actually still drink, because I bet it is fairly complicated with what you've got. But I know that certainly in the general understanding, and sort of in general, people, sometimes people will sort of think, oh, it's actually easier for me to fall asleep after drinking. So alcohol is a bit of a sedative. It can sort of help drift you into sleep early on, but there's not good consequences on the quality of sleep that you get. So even if you fall asleep easier with some alcohol, overnight, the quality of your sleep, the depth of the sleep that you get is worse. So we really recommend limiting that. Or again, if you are going to drink, counterintuitively, earlier in the day. Noise is a big thing that can impact our sleep at night. So trying to really make sure that, when you are going to sleep, or if you're napping in the day and you want to have a really good nap, basically limiting the noise. Now that is not the easiest one to do, right? Because a lot of times noise can be outside of our control. Something that I would encourage as well, if you tolerate them, get a nice pair of earbuds, of earplugs, right? Some soft, comfortable ones, as much that sort of if you can tolerate it, and that can be really helpful for sleep, because it brings down that noise. If you can't control, neighbors doing things, construction work, cars, or you've got partners or kids or other people in the home that make noise, as they do, earplugs can be a cost-effective and a very efficient way at sort of reducing the noise that you have during sleep. And if you can stop, say,
can I butt in there? Sorry, it's Judy.
Absolutely.
Let's butt in there. Somebody sent me something. Can I show everybody? It's this thing. It's like a it's like an iPad. An eye mask. You put it over your eyes, it blocks out all the light, but it also plays, you can stream stuff to it. So it, as strange as it sounds, it's not like, because I can't stand putting things in my ears, it actually plays from here and only you can hear it. It doesn't disturb if someone else is, or so she tells me, it doesn't disturb her husband. But you can play meditational music or mindfulness stuff. Has anybody else reported those things to you?
I've seen, there's lots of devices. Some people like to have that kind of white noise or meditative noise, the sounds. And I think what you might be talking about might use bone conduction to actually do the sound so that only you hear it, but it doesn't have to go in your ears. Does it go like on your head, kind of against your skull?
Yeah.
So those sorts of ways too is another, it's not quite as cheap, but devices like that, I think can be also helpful, because what particularly disrupts our sleep is sudden noises. So it's not so much sort of constant type of noise that disrupts us. We'll sleep through that often. But it's when you have those sort of, those intermittent things that kind of wake us up. And so stuff that either stops us from hearing that or kind of drowns it out with something calm and steady that's not, bursting and, a sudden sharp noise and then it goes away again, or things like that, can be really helpful. And I love the eye mask, the eye cover sort of idea, because that goes towards sort of the limiting light. That's really can be really helpful. Have you tried it? Have you liked it? I think you're on mute.
I just realised I was on mute. Yes, I have, and I'm not really somebody that would normally wear an eye mask, but literally I put on the mindfulness apps, and there's one that's free, because of course they steer you towards ones that cost money a month, but there is one that's free. I'll try and find the name of it, and within 5 minutes of listening to the mindfulness and relaxing ones, I just fall asleep. So it's very handy. So it's quietening your mind at night, which is really hard to do.
Yes, it is. That's really important in its own right, and I think helpful. But the mask and the sound as well, having ways to kind of reduce that, I think can be great additional benefits of devices like that. Next one up here, limit light. I was going to say as well, of course, if you've got blinds and things like that you can close, doors you can close, ways to make it really as dark as you possibly can. But again, sometimes that's hard to control. And eye masks, again, a nice comfortable eye mask that you might wear. I personally always keep earplugs and eye masks sort of right by bed. They're not my preference to wear, but if I know that my partner's coming in later because I'm going to bed first or she's getting up early or anything like that, I rather that than I sleep better sort of with those than without them. And we know that light, even sort of low levels of light in the room, is quite disruptive. And certainly if someone, comes in and flicks on the light when they're getting into bed or something, that's a big disruption. And so stuff like eye masks, if you can find a comfortable one that doesn't bother you too much. But also encourage you to experiment a little bit. If you're someone who's never liked earplugs or things over your ears or eye masks, try a few different ones. There are some that have different materials, different tightnesses. You might find one that you tolerate. And of course you might not. Everyone's different. And if you don't, you hate it, don't wear something that you hate. That's not going to help you sleep. If you're sitting there being like, oh, these stupid things in my ears, and that's, working you up, then that's not going to help you sleep. Diet can be relevant for our sleep as well. I don't know the best recommendations here, so I'm probably not going to actually give you any, because I think I know there's sort of, multiple small meals that might be taken. And so I think there's additional complexity here. And I don't know actually how that interacts in this context. Normally we would say, try to eat, and try not to have a big meal right before bed. Try to sort of stop your eating a few hours before bedtime, but that may contradict with other nutrition or dietary advice you're given. So perhaps I won't actually comment on that in this instance. Exercise or activity can be helpful. There's not super robust evidence around exercise and sleep specifically around it improving sleep, but generally the couple things that we'd recommend is that some activity in the day is probably helpful, and not doing anything too strenuous in the few hours before sleep is a good one. Smiling Mind is the app that Judy mentioned. Smiling Mind is great. I can attest to the quality of its work. We actually use some of its mindfulness audios in our sleep intervention trials that I run. So work with them. They're lovely, and it's definitely good quality. Let's see. All right. Room temperature and related to that, body temperature are important for our sleep. That's really just around getting comfortable. If you can, a little bit on the cooler side tends to be better for sleep. Not cold. I don't mean you don't want to be cold and shivering, uncomfortable, but slightly cooler than you might during the day, if it's possible, is helpful. Ways that might get managed beyond stuff like just air conditioning, of course, which I realize can be costly, but things like fans, making sure that the blankets that you have, are adjustable. So if sort of you've got a thick one and that's going to make you too hot, trying to say, can you have, a couple layers or something like that, so that you can sort of keep your temperature at about a comfortable point. If you end up too hot or too cold, that can interrupt your sleep. Again, not something that is so easy to do. But where possible, good air quality has been related to sleep. Again, I think this is it's not the easiest for people to concretely do things about, but certainly say when there are fires or stuff like that, we've had sort of the smoke around, if you are able to shut off your house and things like that to try to keep at least your indoor air quality a little better. And bed comfort being important. That looks different for different people. So there's not sort of this mattress or that mattress or hard or soft or whatever, but it's important basically that it be as comfortable as you can for whatever that means for you. So these are sort of the basics. You probably all knew all of these already, but if you didn't, at least we're on sort of the common page. Now there's a few other things that I'll talk about, some other tips. So I've talked about that sort of sleep drive or hunger already. The higher it is, the easier it will be for sleep to occur. So some things that can reduce that sleep drive, if you sleep in later, right, then you may not be awake long enough at your normal bedtime. Napping can reduce tiredness, caffeine or stimulants do, and things like lower activity or rest can reduce that a little bit as well. Now, kind of in order, I would say stuff like low activity or just rest, taking it easy, less so than things like napping or sleeping in. And if you do sleep in, that's not, again, if you're sleeping really well and you don't have to force yourself awake, but you might just be aware of or be mindful of that. And when you think about your next bedtime, so I use the example, right? If I sleep in till say 11 a.m., it's going to maybe be hard for me to fall asleep at 9 p.m. And so I might either consider, do I try to wake up a little bit earlier? Or do I sort of say, well, I'm sleeping really well, and it's that rare time that I am sleeping well, I'm going to sleep into 11. And in that case, when I wake up, what I might say is, it's not likely I'm going to fall asleep super easily at 9 p.m. Maybe tonight I go to bed a little bit later, right? Because rather than try to set myself up, and what we're really trying to avoid as well is we want to avoid you sort of being frustrated about your sleep. So we want to avoid a situation where, say, I'm not tired at 9 p.m., but I get into bed and then I don't sleep. And then I'm frustrated that I can't sleep. And now my mind gets more active, right? And I'm sitting there and I'm not sleepy. So my mind thinks, and I start turning to all the problems, all the things I need to get done, all the things that aren't right. And, you sort of start this whole cycle. So we want to kind of avoid that as much as possible. And some of the ways we can do that is, by making sure that we are sort of sleepy when we try to go to sleep. If you slept into 11 a.m. and you normally go to bed at 9 p.m. and you're really sleepy at 9 p.m., fantastic, go to sleep. I'm not saying go to bed later or don't sleep, but sort of be aware that, well, you might not be as sleepy at that time. And you can't kind of force sleep. So if you know that you were, had a really long nap, or you know that you slept in and you're not feeling sleepy and it's your usual bedtime, I wouldn't try to force your normal bedtime. Sort of, hopefully this education helps you understand what you may be feeling, and that then you can take some action and sort of say, well, yeah, I'm not really sleepy. That makes sense that I'm not that sleepy tonight. Maybe I'll go to bed an hour or two later when I'm starting to feel sleepy. Some activity during the day can be helpful. Sort of list exercise here, but it doesn't have to be intense exercise. Any sort of activity, stuff that sort of uses some energy. I mentioned already, but quitting caffeine late in the day. If you are someone who sometimes, and I don't know how much any of you do this, but some people will say, oh, in the afternoon, if they're feeling really tired, they need a bit of pick-me-up, have a coffee or something like that. Some degree of activity can be helpful. A gentle walk and light can be helpful. So going, sitting outside, even if you don't want to be active, if you're able to go and sit in the sun for a little bit, or not directly in the sun, but sit under some shade, so you're not getting skin cancer, because I don't want to promote that either. But getting some light exposure, right, can be an alternative to caffeine. If say it's 4 p.m. and you're feeling pretty tired, and you're thinking of having a cup of coffee, what might you do instead? If you can be a little bit active, go on a gentle walk or something like that, or more active if you do exercise and that's safe and fine for you. Big tip here in general for sleepiness, it can be counterintuitive, and I'll talk about this more, but don't go to bed until you are sleepy. Or if you do want to rest in bed, I'll say don't try to sleep until you are sleepy. So the notion here is, again, around that we don't want you to be frustrated when you're sleeping. Sleep isn't something that we force. Sleep's something that we sort of fall into. And what is not helpful for falling into sleep is if you get into a routine where, every night you have trouble sleeping. So every night you get into bed and, the first thoughts as you're lying down on your pillow are, this isn't going to go well. I'm not going to fall asleep. Tonight's going to be another bad night. Those sorts of things are not conducive to sleep. And so just waiting, even if that means staying up another hour or two, or what it might take till you actually are sleepy. Sometimes we call it riding the sleepiness wave. So when you feel that sort of sleepiness and you're like, now I feel like I could fall asleep, that's the point that you want to get into bed and try to sleep. Now, after cancer, and in general, when people aren't feeling physically well, they're often tired, need extra rest. It might be uncomfortable to stand or sit. And so you might lie down more. So I will say in this context, when I talk about don't go to bed, you might get into bed, but you can distinguish if you can and try to sort of separate in your mind, getting into bed to rest and being in bed to sleep. And so sort of say, okay, I'm in bed to rest, that's fine, but I'm not trying to sleep yet. And in some sense, the difference is like, well, what's the difference between these two things? But part of it, I think, is a little bit in our mindset and in our attitude. If you say, wow, it's 9 p.m. and I just don't have energy anymore and it's cold and I just want to lie down and be under covers and be comfortable, but you're not expecting to fall asleep yet. If you're awake for 2 hours, that's not so frustrating. If you say, I'm going to bed and I'm going to fall asleep at 9 p.m. and you don't start sleeping till 11 p.m., then you've been like, I was supposed to be sleeping 2 hours ago, right? And you start this sort of, it's more bothersome. To help our bodies and our minds sometimes distinguish this, some stuff that I'll recommend to some people, and not everyone needs this and not everyone can do it, but even if you want to get in bed, if you are in bed and you're not planning to sleep, if you can make any differences from when you're in bed and you are planning to sleep, that might be like a different pillow. That might be like being on one side of the bed when you're just resting in bed and on the other side when you're actually going to sleep. That can be flipping head to toe. So you rest in bed with your feet at your head and your head at your feet, but the opposite direction, things like that are some of the ways that we do this sometimes. The analogy and the rationale behind this, don't know if any of you will have ever heard of Pavlov's dogs. Kind of famous experiment done a long time ago where someone would ring a bell and feed dogs, and ring a bell and feed dogs. And eventually what happened is when he rang the bell, not only were the dogs expecting food, they actually started salivating. And it just shows what can be conditioned. So their bodies knew bell food to the point that they started getting ready for that, right? We want to do the same thing with bed and sleep. We want to condition bed, sleep, bed, sleep. We don't want to condition bed, frustration, bed, be awake. Now you might need to rest in bed. And so that's where this idea of, a different pillow, a different side, flipping around, or anything that you might do like that sort of separates what is the cue to me that now I'm sleeping versus what are the cue that, now I'm in my bed resting if you do that. If you are able to rest somewhere outside of your bed, got a really comfortable couch or chair or things like that, that can be quite helpful. But not everybody has that. And if that is the place for you, I think that's totally fine. Let's see where you might be able to make some subtle cues that tell your body and tell your mind, this is reserved for just when I'm actually sleeping in bed. Our body clock I talked about before, and that it's quite important for our sleep and our wake. Some of the things that sort of are very important, light and dark signals, so that the light, the bright light in the day and the darkness at night, really helpful for what determines that clock. Because of that, if we have really irregular wake and sleep times, that can confuse our body clock, sort of disrupt it, make it less strong and less synchronized to where we want it to be. So what our ideal situation is, internal physiological body clock is the same as our external behavior. That is, when I'm actually awake is when my body clock tells me to be awake, and when I'm asleep is when my body clock tells me to be asleep. The example I like to use, if this is sort of confusing and you wonder, what do I mean by those being linked up? If you've ever traveled anywhere and you've ever gotten jet lag, that is what happens. Jet lag is the feeling that you get when your behavior, when you actually sleep and wake, and your body clock are no longer synchronized with each other. When those are separated is what we experience as jet lag. And if you've had big trips anywhere, you'll know how bad and unpleasant jet lag could be. Thank you for joining, Robert. So we ideally try to synchronize those as much as we can. Light is the main thing that sort of does that, and darkness. As much as you can, having a regular routine helps with this. Now I realize there's limits to that, and there's lots of things that influence a routine that we may not control, and lots of things that sometimes you're making choices and balancing between, well, this might be helpful routine for sleep, but that might be more helpful for something else. So we make these trade-offs. So this isn't going to be perfect. This isn't going to work for, it's not something that you're going to sort of get to perfection. But where it's possible, picking a regular wake-up time, and I sort of say, don't vary from this, but vary from it as little as you are able, as you are comfortable with, or you tolerate. I say wake-up time here over bedtime, and we often focus in the sleep world on our wake-up time, or trying to normalize or stabilize what people's wake-up time, because we can't easily control people's bedtime. We can tell you, go to sleep at 10 p.m. You're not sleepy at 10 p.m. You're not falling asleep at 10 p.m. There's not a whole lot that you can sort of directly do about it at the 10 p.m. time point. It's a little bit easier to, wake up around the same time to try to have some routine there. And again, always be mindful of yourself, I guess. Be mindful of what your body's telling you. I think it's not, if you're really tired and you're sleeping in, I'm not sort of saying, I'll disrupt your sleep and just go ahead and force yourself awake. But where you can have a regular wake time, that's really helpful. Where you can make that a regular wake time, every day is also quite helpful. So sometimes people will say sleep in much more on the weekend than the weekday. And that's not ideal for sleep, because it gives your body clock a different signal. On, Friday you get one thing, and on Saturday or Sunday you get a different signal that it's supposed to be synchronized to a different time of the day. And that's sort of not as ideal. bright lights in the morning, dim lights in the evening, and where you're able to, even if you are a little bit tired on a day, staying a little bit active, trying to do your routine as much as you're able is helpful. So I sort of say, don't take it easy. And I don't mean be hard on yourself. What I mean is sort of just as you're able, even if you are a little bit tired or low on energy, if you're able to kind of keep your routine as much as you can tolerate, that'll be helpful in general for your sleep. And of course, you can't always do that, and that's okay. Question, is it better to nap during the day with the curtains or blinds open? Does the light help maintain the body clock? Interesting question. I don't know if I know the answer fully to that. It will certainly be worse for the nap to have the light on. It might be better for your body clock long term to get the light during the day, but the nap itself would be more disrupted. I suppose if you tolerate it, it wouldn't hurt to have the light and the blinds open. Like if you don't need it in order to get what you needed out of the nap, if you don't need it for the rest and restoration you could have during the nap, having your blinds or your lights on while you nap. I would think your nap would not be the same quality that it would be without that, but if that's okay for you, it wouldn't be a bad thing. The other thing you could do though is just nap in darkness if you need to and get light before or after the nap. There's normally plenty of hours in the day to get that light. When I talk about light, there's lots of ways we can get light. I normally recommend people get bright light around when you normally wake up. Not too much before you normally wake up, or that can kind of start shifting your body clock, perhaps too early. Bright light during the daytime also can help. And I've got some examples here on the left of ways to get bright light. So the easiest one that all of us should have some sort of access to is sunlight. The sun is very bright. You don't need to look at the sun. Even if it's a cloudy day, sunlight is normally much, much brighter than indoor light. Often orders of magnitude. So like the overhead lights, say that I have in an office, that will be dimmer than a cloudy day in general. If it's like, the world's darkest thunderclouds, maybe not. But in general, cloudy days, even daytime being out in the daylight or having a window is going to be more light than overhead lights. So in the day, that's really helpful. If you find it hard to get outside, you've got a really dark house, you don't have the energy to get out and about, there are artificial ways that you can simulate that. And I've got two examples here. So the bottom is a light, what we call a light box. So it's just a box with basically a big square light, and you can sort of pop that, say, by where you have breakfast or things like that. And on the left here, this diagram is sort of what we call light glasses. So they're glasses that you put on, you can wear them over other glasses, and they just have little lights basically that kind of shine at your eyes. It sounds more annoying than I think it actually is. Most people are okay with them, some really don't like it. And that's another way of getting this sort of light. One of the symptoms of chemo is light sensitivity, absolutely. So many people may be particularly sensitive and may not like this, or may have trouble with sort of some of the daytime light exposure. So certainly don't do things that make you feel worse, I guess I would say. But where you can tolerate it, if it is comfortable and at the level of light that you can tolerate and is okay, getting that exposure is generally helpful. It can be sort of the duration can be adjusted as well. So, if you sort of 10 minutes is okay and past that starts to feel uncomfortable, get 10 minutes. If it's, this much brightness is okay and sort of brighter than that isn't, I'd say sort of get the brightest light for the longest that you find, comfortable and tolerable. Up to around probably an hour or so is helpful sometime in the morning-ish in terms of just that kind of body clock. And again, you can use this throughout the day as well. Light is really helpful for alerting us because it sends even quite acutely signals to our body clock to sort of be alert and wake up. And so if it's 1 p.m. and you're feeling a little bit tired, say sitting on a porch or having a walk outside or something like that, if you can tolerate that, can be quite efficient for getting some alerting kind of signal into your body. The other place that this can be problems, oftentimes people who have migraines or headaches are often light sensitive. And so, but if you have that or experience that, to be sort of mindful and be careful around, I guess, the light that you get and making sure that this isn't triggering anything like that or making that worse. Flip side of bright light is that our body clocks as well respond to basically low light at night. So you want to have, where possible, the body clock will be the most sort of robust when it gets a lot of strong light signal in the daytime, and where that's absent in the nighttime when you want to sleep. Generally speaking, I would say try to have dim or very low light several hours before you are aiming to sleep. So if I wanted to sleep, say at 10 p.m., then 3 or so hours before that, I would be trying to be in a much lower light, so say around 7 p.m. A simple rule of thumb that you can follow that often works pretty well is sort of follow the sun. So when the sun's setting, you want to be reducing the amount of light that you're getting exposed to. But less rule of thummy, several hours before you sleep. Because if you're someone who normally sleeps at 1 a.m., then around 10 p.m. might be when you want to really try to reduce the amount of light that you're getting exposed to. And if you wanted to go to bed at 8 p.m., then you would need to try to reduce your light quite a bit earlier. Many people have lots of electronic devices these days, televisions, laptops, phones, iPads, whatever it may be. Using night shift mode, which reduces the amount of blue light that they emit, and perhaps, and probably more critical than that, setting the brightness as low as you can tolerate is helpful. For things like TVs or televisions, where you can't really easily adjust how bright they are, you can try to sit further away from them. The further you are from a light source, the less total light enters your eye. Another recommendation that I often give people, if you can, in the daytime, overhead lights don't tend to be as bright as we would ideally get for our body clock, to say like some sunlight or some daytime light. At night, they are much too bright for us. And the way I often think about this is, if you imagine where humans were, say, 500 years ago, that's more like what our body clocks are designed to respond to. So you'd be awake, the sun would be up. When the sun goes down, that's pretty much it. You've got moonlight, you've got starlight, maybe you've got a little bit of firelight. That's the kind of level of light that our body clocks respond best to sort of cue for sleep. So overhead lights tend to be much too bright. If you can have some lamps or things like that, that can be quite helpful as ways to kind of bring the light indoors down. If you're going to bed earlier, and especially in the summer when the sun's up quite late, shutting blinds, shutting curtains, things like that, a few hours before you sleep as well, to really kind of bring down the light in your house as much as you can. Still do this, I would say, with safety. So one thing that comes up, like if you are getting up at night, or you do have to get around, making sure that there aren't trip or fall hazards, so that having some night lights or things like that can help make sure that you can still see and that you're not going to fall on something or things like that, or bump into things that you don't want to be. So whenever I recommend people when reducing the light, it's great for your body clock to reduce light. Obviously, you want to do that still with safety and getting around your home comfortably and safely in mind. So we've talked a lot about some behaviors. I want to talk a little bit about our mind. So quiet mind is quite helpful for good sleep. And if you have a really active mind, that can override your sleep drive, can override those body clock signals. So where possible, some of the things we think about, where possible, addressing kind of mental activity, busyness, stress, overload, working on mental health if you can. We'll often think about managing triggers if you have those. So that might be like emails or phone or social media, or if there's places that tend, if everybody's different, right? So if sort of, this is something I look at and it tends to wake me up. It tends to make my mind go. It tends to make me start thinking a lot or be active. Trying to avoid that in the time before sleep. That doesn't mean that you don't do that at all. It means you don't want to be doing that kind of right before bed. you might schedule that if there's, things that you do that do kind of, get your mind really active, really going. Can you schedule that for the morning? Can you schedule that for the afternoon? So that you avoid it in the couple hours leading up to bed. Try to really, where possible, think about some bedtime habits or routines, quiet and calming things. Ideally, this isn't just when you want to sleep. Again, it would sort of be probably an hour or two before you want to sleep, that you really start kind of quieting your body, quieting your mind. And routines where you're able to can be helpful with this, because they kind of get us a bit of a rhythm that we can follow, where sort of, I don't know, let's say that you like to go on social media, you read some news articles, and then you start reading the comment sections on news articles. And, there's a variety of opinions there. Some of them you may strongly disagree with, and that works you up. All right, let's move a routine where that doesn't happen right before bed, right? If there's things, conversely, that you find relaxing, books you enjoy, shows you enjoy, cup of tea, ideally non-caffeinated tea, right, that you can sort of build in, where you say, this is my rhythm, this is what I do in the lead up to bed. Mindfulness, relaxation activities, yoga. I have exercise here, but I mean sort of very, very gentle, very easy sorts of things, stretching, quieting, calming things, the sort of activity that would, that brings you down, I guess. And you'll know for yourself, I think, what those are. And if you try something and, it's doing the opposite of that, don't do that. Listen to yourself, learn yourself, find for yourself, what sorts of activities may be useful with this. But these are ones that people often find. A walk after dinner, mindfulness activities, those sorts of things. Some people like to talk or journal or write. You can do that about your thoughts and feelings is one way that people will work towards a quiet mind. It can be helpful strategies for managing some of the activities and thoughts that you may have. If you've got a lot of anxieties or worries, that's not uncommon. One of the things we recommend in sleep is not that you sort of never worry about them, because that's not realistic, but to try to set a worry time, right? So from a sleep perspective, and I'm not talking so much from a mental health perspective, because obviously from mental health, ideally we help you manage your anxiety the best that we can. But just from a sleep perspective, the main problem with it is the timing of it. So ideally, the time that you sort of sit there and think and sort of do your worrying isn't when you're trying to fall asleep. For a lot of people, that's exactly what is kind of most natural, because perhaps during the day you can distract yourself, you have other things to do, you're engaged with stuff, and it's when you sort of lie down to sleep that all of those distractions or anything else goes away, and you're kind of just left with yourself and your own mind. And that can be the easiest time, in a way, to be thinking about all those worries, all those concerns that we hold. But it's not the easiest time to do that, or the best time for sleep to do that. And so actually dedicating some time is a strategy that we'll use. One of the ways that can work in the moment is that sort of, if that thought comes in, you don't force that thought out. You sort of acknowledge that thought, that worry, and you sort of say, and I'm going to think about that, and I'm going to, worry and plan about that tomorrow morning or tomorrow at 10 a.m. I've got a time when I'm going to do that. Acknowledge, recognize the thought, and try to let it go when you're going to sleep. And having a set time can be useful, because you sort of know you're not putting it off, you're not avoiding it. It's not that you're not going to think about this, it's just you're not going to think about it right now. And then sometimes we'll talk about unhelpful thoughts or beliefs around sleep that you may have. And I'm not going to go through all of these because it gets quite individual. I'm happy to chat with people about any. But sometimes we may have thoughts like, I can't function well unless I get a good night's sleep. Oftentimes, we can do relatively well even without a great night's sleep. It may not be perfect, but it's okay. I have to get 8 hours of sleep. 8 hours of sleep is great. Many people need and function well without just 8 hours of sleep. If I wake up at night, it's a bad night's sleep. Waking up at night is quite normal, and it doesn't mean you necessarily won't feel refreshed in the morning. All of us have multiple micro awakenings. When we do sleep studies, when we measure sleep in detail, most people wake up many times throughout the night, But for many people, they wake up and they fall asleep quite quickly, and we don't even really remember that we woke up. So we might wake up 10, 15 times. It's quite normal. We don't really remember it when you fall right back asleep. So if you wake up and you spend half an hour awake, you'll probably remember it. We call these sometimes unhelpful sleep beliefs because they're these things that can sort of, the more we worry about sleep, the more we try to control sleep or force sleep, the more that we actually lose control of it, the more that we can't sleep. And so a lot of times, we work quite hard to have some acceptance and in some sense to let some go around sleep. Often the way I think about it, if you want to control your sleep, the time to do that is during the day, during the waking hours. It's not once you're trying to fall asleep. At that point, whatever's happened has sort of happened, and sort of relaxing, quieting your mind, letting go. And if you sleep, you sleep. And if you don't that night, you don't that night. Once you're sort of at that point of trying to fall asleep, you won't be able to if you're not sleepy, you won't be able to just force yourself into it. I might just end there. I think I've talked about all the key points I have. I want to just make one kind of final point, which is, I've tried to talk a lot about some ideas about why we sleep, what influences our sleep, some of the things that may help with that sleep. And of course, a lot of these are helpful, but they won't always be enough for everyone. If you are finding that your sleep is a significant problem, if you find that it lasts over multiple days, then you can seek out more help, speak with your healthcare team. A GP can refer you to specialists. You might want to be assessed. There'll be sleep physicians that can do more detailed assessments to see if there's sort of known physiological causes of poor sleep, or if you might have any sleep disorders like sleep apnea, like where you stop breathing, that's causing you to have more sleep problems. And there can also be referral to specialists on behavioral sleep management, which is often psychologists, and that's available. And you can see them sort of through the mental health care plans can often get you rebates on that. I list as an example here, and there's other ones, but the contact details for our Monash University's Healthy Sleep Clinic. We have a big range of sleep experts here, including sleep physicians and psychologists. We know about all kinds of sleep disorders, behavioral strategies, mental strategies. We understand body clock, and we both have clinicians. It's a clinical service, but we also have a great deal of research that backs a lot of this. And so this is available if you would like. You can get referrals. Your GP would be able to refer you or people you know over. There's other sleep experts and specialists available as well, of course. And with that, I just want to thank you all again so much for coming. Thank you for the questions. Thank you for the experiences that you shared here. Love to hear more. Very happy to talk to individual, if you want to talk specifically about your sleep or things that you've tried or haven't tried, or questions or stuff that you want for yourself as well, very happy to do that. If you would like to talk with me more about anything, my email address is here. Please feel free to reach out. And I would also say, if you would be open to sharing some of your experiences with me to help me learn about what that's like, I would love that as well. I'm working with PanCare and hoping to spend more of my time in my job understanding and thinking about ways specifically to support people's sleep after pancreatic or upper GI cancer, and understanding what are priorities to all of you, what your experiences are, and where you wish work would be done can help me choose the right places to work. Because ultimately, if I do this, it's not me trying to do work for myself, but trying to do work that's actually ideally what you want done. So would love to hear from you if you'd like. And of course, if you don't want, that's all right too.